My name is Mark Bayley. I'm the Medical Director of the Brain and Spinal Cord Rehabilitation Program at UHN Toronto Rehab. I've had the privilege of being involved with the Ontario Neurotrauma Foundation for a number of years, and my role has been as the chair of the Brain Injury Quality of Life Committee. We oversee the brain injury related activities at ONF. ONF's contribution to my work has been huge. They have supported some of the research we've done looking at concussion as well as looking at brain injury, more severe brain injury. The Ontario Neurotrauma Foundation has been very helpful, involved in some of the things that we've done as groups. And so the work that they've supported included development of guidelines for concussion as well as guidelines for more moderate and severe traumatic brain injury. The Ontario Neurotrauma Foundation for our program and for spinal cord injury across the country has been very engaged in helping us develop high performance indicators for understanding whether programs are following the best practices. So ONF has been a huge contributor to driving research into practice. I feel that one of their strongest or most valuable contributions have been in their role in driving best practices and building a community of practice of brain injury and spinal cord injury practitioners across the province. This is particularly relevant in my area, clinically, which is brain injury, where the guidelines that have been developed for concussion and for moderate and severe brain injury have been recognized globally as being the leading guidelines for helping people with persistent symptoms after concussion, and have been recognized with peer-reviewed publications as well as dissemination around the world in the International Brain Injury Association as well. My hope for ONF for the next 20 years is that we continue to do the great work we do in identifying what are the key practices, that we build connections between researchers and clinicians, and most importantly, we take advantage of the opportunity to ensure that every single person who has a brain injury or spinal cord injury gets the best care at the right time, in the right place, and results in the best outcomes. And I think that ONF is well positioned to do that, not just in the public sector, hospital sector, but also in the community, also in primary care practitioners' offices, so that the patient or the kid who gets concussion, that family doctor or that primary care practitioner or that nurse practitioner will know what the best practice is, and if they don't, that they'll quickly go to something that ONF developed. And finally, I think that providing those individuals with the best care, we need to then measure how are we doing. And ONF for the future, I think, will be a key provider in evaluating the quality of care that we provide in the public sector as well as in the private sector for people who are injured on the work site or also through motor vehicle accidents.